Workers handling hazardous waste can experience high levels of stress. Their daily task may expose them to toxic chemicals, safety hazards, biological hazards, and radiation. They may develop heat stress while wearing protective equipment or working under temperature extremes, or face life-threatening emergencies such as explosions and fires. Therefore, a medical program is essential to assess and monitor a worker's health and fitness, both prior to employment and during the course of work, to provide emergency and other treatment as needed, and to keep accurate records for future reference. In addition, OSHA recommends a medical evaluation for employees required to wear a respirator. Certain OSHA standards include specific medical requirements. Information from a site medical program may also be used to conduct future epidemiological studies, to adjudicate claims, to provide evidence in a litigation, and to report workers' medical conditions to federal, state, and local agencies as required by law. The program presents general guidelines for designating a medical program for personnel at hazardous waste sites. It includes information and sample protocols for pre-employment screening and periodic medical examinations, guidelines for emergency and non-emergency treatment, and recommendations for program record keeping and review. In addition, it supplies a table of some common chemical toxicants found in hazardous waste sites with recommended medical monitoring procedures. Developing a program. A medical program should be developed for each site based on its specific needs, location, and potential exposures of employees at the site. The program should be designed by an experienced occupational health consultant in conjunction with a site safety officer. The director of site medical programs should be a physician who is board certified in occupational medicine or a medical doctor who has had extensive experience managing occupational health services. A director and/or examining physician with such qualifications may be difficult to find due to the shortage of doctors trained in occupational medicine in remote geographic areas where many hazardous waste sites are located. If an occupational health physician is not available, the site medical program may be managed and relevant examinations performed by a local physician with assistance from an occupational medicine consultant. These functions may also be performed by a qualified registered nurse, preferably an occupational health nurse, under the direction of a suitably qualified physician who has responsibility for the program. All medical test analysis should be performed by a laboratory that has demonstrated satisfactory performance in an established inter-laboratory testing program. The clinical or diagnostic laboratory to which samples are sent should meet either minimal requirements and the Clinicals Laboratories Improvement Act of 1967 or the conditions for coverage under Medicare. These programs are administered by the Healthcare Financing Administration, HCFA, U.S. Department of Health and Human Services, DHHS. A site medical program should provide the following components: surveillance, pre-employment screening, periodic medical examinations and follow-up examinations where appropriate, termination examination, treatment, emergency, non-emergency, on a case-by-case basis. The effectiveness of a medical program depends on an active worker involvement. In addition, management should have a firm commitment to worker health and safety, and is encouraged to express this commitment not only by medical surveillance and treatment, but also through management directives and informal encouragement of employees to maintain good health through exercise, proper diet, and avoidance of tobacco, alcohol abuse, and drug abuse. In particular, management should urge prospective employees to provide a complete and detailed occupational and medical history, assure employees of confidentiality, require workers to report any suspected exposure regardless of degree, require workers to bring any unusual physical or psychological conditions to the physician's attention. Employee training should emphasize that vague disturbances or apparently minor complaints such as skin irritations or headaches may be important. Surveillance. The following individuals must be enrolled in a medical surveillance program according to the OSHA standard 29 CFR 1910.120. Workers exposed at or above permissible exposure level for 30 days or more per year, regardless of respirator use. Members of hazmat teams. Workers who are injured due to overexposure from an emergency incident involving a hazardous substance. According to the OSHA standards, Workers enrolled in medical surveillance programs must have medical examinations at the following times: prior to assignment, annually, at termination of employment or reassignment, as soon as possible following notification by the worker that he or she has developed signs or symptoms indicating possible overexposure to hazardous substances, or that the worker has been injured or exposed above the PEL in an emergency situation. At more frequent times, if the examining physician determines this necessary. The content of the medical examination is to be determined by the attending physician. An employer can require that the worker take a pre-placement medical examination before they are hired as a condition of employment. The physician performing the medical examinations must have a license to practice medicine along with experience in occupational safety and health. A license to practice medicine along with a board certificate in occupational health. Exams are to occur on company time. The company pays for medical examinations. Previous to the administration of any medical examinations to the worker, the employer is required to provide the examining physician with a copy of the OSHA hazardous waste standards, a description of the worker's duties, the worker's exposure level or anticipated exposure level to hazardous chemicals, a description of any personal protective equipment used by the worker, information from previous medical examination of the workers which is not readily available to the examining physician, information required by the Respiratory Protection Standard 29 CFR 1910.134. Following all medical examinations, the employer must provide the worker with the physician's opinion as to if the worker has any detected medical condition or conditions which would place the worker at increased risk by working in hazardous waste operations, emergency response, or from respirator use. The physician's recommended limitations upon the worker's assigned work. The results of the medical examination and the test if requested by the worker. A statement that the worker has been informed by the physician of the results of the medical examination and of any medical condition which required further examination or treatment. Any department presently using any substances identified in the NIOSH Registry of Toxic Effects of Chemical Substances and its supplements must ensure that it is complying with government standards for the protection of its employee. Specific information concerning handling may be obtained from the MSDS. Access to medical and exposure records. By submitting a written request to your company, employees and their representatives have the right to see and copy at cost the following information: medical records and records of exposure to toxic substance or harmful physical agents, records of exposure to toxic substances or harmful physical agents of other employees with work conditions similar to their own. Material safety data sheets are other information that exist for chemicals or substances used in the workplace. A medical plan is a critical part of your overall emergency response program. Heat stroke is the most serious of health problems in hot environments. The system simply breaks down under heat stress and sweating stops. No one knows why it happens, and generally there's no warning. A heat stroke victim's skin is hot, dry, and usually red or spotted. Body temperature is 105 degrees or higher and rising. The victim may be mentally confused, delirious, or in convulsions, or unconscious. Unless the victim receives quick and adequate medical treatment, it's all over. We can't provide medical advice. That's up to your personal or company physician. In case of emergency, always call an ambulance for assistance. The generally accepted first aid treatment for heat stroke victims is to remove them to a cooler area and soak their clothing with cool water. Fan the victim to increase the cooling. It's critical to get professional medical treatment as soon as possible. Heat exhaustion is caused by the loss of fluid and sweating, sometimes by the loss of salt, or by both. The worker with heat exhaustion still sweats, but also experiences extreme weakness or fatigue, nausea, or headache. In most cases of heat exhaustion, treatment is simple. Have the victim rest in a cool place and give him or her plenty of liquids, particularly cool water. In the years past, physicians recommended the use of lightly salted water. However, this medical advice is no longer used. Persons with heart problems or those on low-sodium diets must have a physician's advice on proper treatment. We mention these two illnesses to give you an idea of what to do in case of a severe problem in hot environments. To be honest, persons who work in hot environments every day rarely have a heat stroke or heat exhaustion. Even fainting from heat environments is rare unless a person stands erect or immobile for a long period of time. If you're busy moving around, fainting is not your problem. If a person does faint due to heat, the best thing to do is to remove the person to a cooler area. Lay the person down to allow blood to return to the brain more quickly. After gaining consciousness, moving around would be of value to increase blood circulation. These are just some of the examples of the problems that can occur, but again, these are rare. Normal everyday work can be made less difficult if you take proper precautions for the work. So let's take a look at what you can do. In the course of a day's work, you can perspire away as much as 3 gallons of body fluid. More times than not, dehydration and loss of salt occurs from this fluid loss. Try to drink as much water as you lose. Drink water frequently. In hot environments, don't always depend on thirst to tell you it's time to take a drink of water. In hot environments, you should drink water every 15 to 20 minutes. If you sweat a lot, drink plenty of water. If you choose to take salt tablets or lightly salted water, make sure you have the advice of your physician. Next, we come to a touchy subject. You're certainly aware that drugs and alcohol are prohibited in the workplace. But how about getting bombed the night before, then trying to work the next day? Alcohol dehydrates your body, and it takes a long time to correct a problem. If you work in hot environments, stay away from alcohol. To summarize the information just reviewed, let's say you should always use your common sense. Staying cool may not be possible, but frequent rest periods, plenty of water intake, and following your organization's work practices go a long way to reducing the stress of heat. Your job is being aware of the hazard, then making the effort to reduce the effects of heat on the body. It includes such things as not taking chances and making sure of what you're doing before you do it. If you're getting dizzy or feeling the effects of the heat, let your supervisor know. Not taking chances, that's the key. You can work safely in hot environments, but you need to know what the hazards are and how to prevent the heat from becoming a safety and health problem. Drink plenty of water. Follow your company's procedures. And of course, stay off the booze. Your safety and the safety of your coworkers deserves no less.